It's a pleasure for me to do this presentation on how the community consultation sessions went on in Cameroon on behalf of UNHCR and WFP colleagues involved in this process. Next slide, please. So just to share with you an overall context for Cameroon. Cameroon has been receiving Central African Republic refugees in the East, Adamawa and North regions of Cameroon since 2007 for the first wave and 2014 for the more recent waves. So what is worth noting is the fact that these refugees are not in income settings exclusively. They are scattered over a large number of villages, approximately 300 or above 300 villages in these three regions. So you understand that with the protracted nature of the crisis and the diminishing resources, there's a need to effectively use the limited resources by making sure that we prioritize the needs of the most vulnerable, and we are equally able to transition to early recovery and resilience activities. So WFP and UNHCR, of course, have committed to ensuring the participation of refugees at all levels of the project cycle, making sure that they are included and making sure that they are consulted in a transparent and in a timely and systematic manner. Next slide, please. So overall for Cameroon, 163 consultation sessions were organized. Like I mentioned earlier, the refugees are scattered in so many areas. So progressively over the years, WFP and UNHCR have scaled up their field offices from 2 to about 5 to be more closer to these beneficiaries, to be closer to the refugees. And due to their effective presence in this zone, each field office were given the go-ahead to contribute in selecting the various sites for consultations due to their perfect mastery of their zone of intervention. So altogether, a total of 27 locations were selected for the consultation exercise across the 5 field offices. And it's also worth noting that these refugees some of them are in rural settings, some in semi-urban settings, and some in camp settings, but the majority are in rural settings. Reason why we have the various repartition according to the number of sites and the characteristics of these sites. So for each of the 27 locations, 3 focus group discussions were organized. As Michael mentioned in his presentation, it's very important, especially for the Car refugees who culturally is not too acceptable for men and women to express themselves together. We organized separate focus group discussions for women and for men. Now, at the level of the host community, which is not so much of an issue, one focus group was organized for them. At the same time, multiple key informal interviews were organized, and a total of 82 were organized to accompany the focus group discussions for this community consultation session. Next slide, please. So I'm going to move on with some of the key findings of this community consultation sessions, and the key findings will revolve around protection issues, refugees or beneficiaries' access to information and their knowledge on existing complaint and feedback mechanisms. With regard to protection, we are all aware of some of the protection risks which can come along with targeting or with prioritization. So we wanted to listen to the beneficiaries' own opinion. And from the refugee community, they mentioned 4 major risks linked with tensions within the community. So I guess amongst those who receive assistance and maybe those who do not receive assistance. Protection risks also linked with demonstrations, unrest, and increased malnutrition and increased school dropout rates. So it's equally worthy to worth mentioning that the result at this level from the host community differs a bit. For the host community, they consider that the main protection risk will be linked to increased level of theft and increased level of criminality, especially by youth, such as violence and kidnappings, but otherwise they equally mentions high school dropout rates and increased malnutrition. So we equally gather that refugees are aware that somehow prioritization or targeting has to take place, and reason why they recommended frequently that we should ensure to carry out effective and timely information sharing around this, and also be able to, together with them, address all potential protection risks which might come along with targeting. Next slide, please. So with regards to information sharing, we all know that when it comes to targeting and prioritization, it's very important to make sure that we all are at the same level of information. So feedback from the community consultation sessions indicated that refugees' preferred source of information or communication channel is still linked with the local mechanisms around their community leaders, meetings, community mobilizers, and religious leaders. They also recognize WFP, UNHCR, and other partner field staff as a channel for communication, as well as the use of megaphones. Next slide, please. So at the same time that they recognize their preferred means of communication, they also recognize that there may be some challenges linked with information. Some specific groups may be like people with disability, hearing impairment, mobility impairment, older people, women and children may not have equal access to information. And also refugees by their nature, they are mostly cattle rearers, so they move, and also in the context of a protracted crisis, they move around to search for jobs. So they may be mobile and miss information. Otherwise, some refugees in remote sites, like I mentioned, may equally face some challenges, as well as the issue of lack of network. Next slide, please. So with regards to complaint and feedback mechanism, as earlier mentioned, when it comes to targeting and prioritization, we all know that a robust system for feedback, for complaints has to be in place. So we actually have existing mechanisms in place, but during this session, it was equally necessary to find out if these refugees are aware of these mechanisms and if they have access and they use it. So feedback received from the consultation sessions indicated that they master the local refugee community and community leader platform where complaints can be laid and they can receive feedback. They're also aware that they can lay their complaints at the level of WFP and UNHCR field staff, and they are also aware of the hotline being managed by WFP at the moment. They are aware of all these various complaint and feedback mechanisms. Next slide, please. So just bear with me. I focused on the main highlights of the study, but I hope with the slide we were able to pick out other information which came out from the discussion, but I focused just on the main elements. So I'm going to wrap up the presentation for Cameroon with the key challenges and lessons learned during this process. But the key challenges, of course, with the various sites spread all over, we of course had lots of challenges with long distances to cover in order to factor in the geographical factor. Also, I think Michael mentioned this, staff capacity. The community consultation session is something which is quite time consuming, and with our current staff having already a certain workload, it's not that easy to manage this exercise within the time frames. It was also conducted at the peak or the onset of COVID, and we had to equally quickly factor in COVID restriction measures in place, and it kind of slowed down the collection process as well. One of the major challenges was linked to the limited literacy of the beneficiaries we have. So within us, it's quite easy to understand eligibility criteria. It's quite easy to understand vulnerability and the degrees, the levels. But with beneficiaries, it's quite complex to break it down. So reason why some of the focus group discussions took a lot of time, because we had to try to get the right words to break it down and ensure that they have concrete understanding of what eligibility criteria are so that they could give good contributions. Now, for the key lessons learned, at the end of the study, we took away the fact that involving local communities at all the along all the process reinforces social cohesion between refugees and host communities. Also, refugees are quite aware of the fact that they can remain dependent on conditional food assistance. So several times the need for self-reliant activities was raised and mentioned actually as the more preferred means of assistance. Equally, involving beneficiaries in decision making on future assistance allows them to become more aware. So it was also a form of involving them in the decision-making process, they became more aware, and gives them also the opportunity to also reflect and contribute towards finding solution for their independence. And lastly, they are quite aware of the potential changes that they could normally go through due to prioritization. They are not ignorant of it, they are aware, and they were quite ready to equally contribute and provide suggestions in this light. Thank you very much for your kind attention.